the focus of our public comment is really going to be about the issue of healthcare benefits for part-timers throughout the district. And I'd just like to begin by asking everyone in the room to think about the last time they experienced, that you experienced a health issue. Perhaps you felt ill and needed to get some antibiotic or other medication, or were having some unusual symptom, needed some tests. Maybe you were not sick or worried at all, but simply wanted to keep your health you simply wanted to maintain your health with regular teeth cleaning or vaccination. These should be simple decisions for all of us to make, to go to the dentist, get a prescription, order a test. We all need them and should have relatively easy access to them. Now I want you to think about a part-time faculty member. The roughly 700 part-timers working in our district are a diverse bunch. Some of them have full-time jobs in their industries and teach 1 to 2 classes. Some of them are retired teachers themselves. Many part-timers, however, are actually full-time teachers cobbling together many teaching assignments from various school districts, known as road scholars, road warriors, freeway flyers, full-time part-timers, and other catchy names to describe the sometimes frantic race that drives us from campus to campus. This work, while rewarding and satisfying as any teaching position, is also characterized by instability, which extends into all aspects of our profession. One area in which this instability is particularly disruptive is health. I'm actually not even talking about the health effects of the job or employment situation, but rather the ability of part-time employees to pay for health care as a benefit of employment. Part-time faculty in SMCCCD are excluded from the group health insurance policy offered to full-time classified and instructional employees. Now, most part-time faculty have some form of insurance through a spouse or other employer that is not in this district. According to a recent survey conducted by the union, it was about 62%. The remaining 38% of part-timers either pay for their own health plan, or they went without insurance entirely, or pay for high-deductible catastrophic plans. Instead of accessing an insurance plan, part-timers who teach 2 or more classes are currently eligible to apply for a reimbursement of up to $1,200 for medical expenditures each year. Due to the popularity of this program, it actually grew by about 25% last year. This medical stipend may go up to $1,600 per year for part-time faculty. According to that same survey that I mentioned conducted by the union, the average annual health care expenses paid by part-time employees was $5,519 per year, 330% of what the medical stipend covers. Although the Affordable Care Act has expanded eligibility for health coverage as more people with non-traditional employment and pre-existing conditions can access the system, the costs of the plans are still out of reach for many, as other speakers following me will illustrate. Finally, of the 10 community college districts in the Bay Area, ours offers the second least generous of health payment plans. As you can see in your handout, 7 of the 10 districts in the Bay Area offer part-time employees some form of access to group health insurance based upon some combination of seniority and teaching load. As an organization of faculty labor, we see it as our duty to assure our part-time faculty members of a fair, meaningful, and dignified method of supporting their access and ability to pay for health coverage. We know that our district can do better for all of its teaching faculty. We hope that you will help us in finding a way to make this happen.